Discover SonicWeld RX, the new dimension in the application of resorbable osteosynthesis systems. A resorbable PDLLA sonic pin RX is placed onto a pre-drilled hole and vibrated with ultrasound. The friction at the surrounding surfaces between the sonic pin RX and the bone allows the sonic pin RX to flow into the bone structure, whether cortical or cancellous. The fast cooling down of the material creates a stable bond between the sonic pin RX, the plate, and the bone within a few seconds. The following animation demonstrates this perfect interaction. A pure PDLLA mesh plate is heated up, contoured to the bony constructs, and the pilot holes are pre-drilled. Self-retaining sonic pin RX components are taken out of the clip magazines using a special sonotrode. When ultrasonic force is transferred to the pin undergoes a phase change, allowing it to adapt three-dimensionally to fill all capillary bone structures, resulting in a strength that is over twice that which is available in standard resorbable bone screws. In addition, the head of the sonic pin RX can be completely united with the plate surface, thus creating a perfect interlock between the two components. Advantages for patients. Excellent three-dimensional stability. This is due to the fact that the melted sonic pin RX penetrates into the cavities that are beyond the reach of common screws. Firm connection between the head of the sonic pin RX and the plate surface. This is equivalent to a locking effect, which is difficult to obtain with conventional osteosynthesis solutions. Exceptionally fast implantation. By removing the necessity for pre-tapping of the pilot hole, the SonicWeld RX process substantially reduces operating times. Implanting a sonic pin RX is a matter of no more than 1 or 2 seconds. This is a reduction in operating time of over 50% as compared to conventional osteosynthesis techniques using screws. No follow-up operation required. SonicWeld RX uses the same PDLLA material as the Resorb X, which has proven resorption. Reliable fixation in cortical as well as cancellous bone. Sonic pin RX fixation is particularly effective with poorer bone quality. Further advantages for your work in daily practice. The sonic pin RX can also be implanted at an angle. This is an important advantage, especially when working in cramped quarters. No screw fracture risk. This is because no screwing in resistances need to be overcome. Besides, screw heads can no longer get damaged mechanically or cut off through torsional insertion. No need for emergency screws. Incorrectly applied sonic pins RX can be bored out and replaced with an identical sonic pin RX. Reduced risk of dura penetration in craniofacial interventions.